Hi everyone, what you're looking at here is a simple extraction setup. So when we're setting up for an extraction, normally we're going to be placing our bagged instruments, so we would keep them in the sterilization pouches until it's time to use them in the patient's mouth. And we would place it on a surgical barrier, which looks like that. It's also known as a field towel or drape. Okay, so it is sterile. We use it for surgical extractions, or any extraction really for that matter. So I'm just going to go through the instruments with you. So of course you have your basic setup, Mirror, Explorer, College Player, on tray, off tray. Your anesthetic kit. Okay, normally we'd have a few more carpules for this situation because we want to make sure the patient's well anesthetized. What you're looking at here is a mouth prop, and that's going to help keep the patient's mouth open and alleviate any tension in the jaw. Okay, because sometimes it does take a little time to take out a tooth. Sometimes it goes really fast, and this helps keep the patient's mouth open with ease. This here is a Minnesota retractor. This helps to retract the cheek or lip away from the working area. Keeps it safe, so you might need that. Then getting into the instruments to help take the tooth out or to extract the tooth. First we're going to loosen up the gingiva around the tooth. So we use a periosteal to take care of that. So that just pries away the gum from the tooth. Once we've done that, we will move on to the elevator. And the elevator helps to lift the tooth out of the socket. So it helps lift it up and kind of helps bring it up. Once we've done that, we are then going to use our forceps. So forceps according to the tooth that we are working on, and we'll discuss that in another class. So these forceps help to luxate the tooth back and forth. So normally you're holding this and you're just giving a gentle wiggle back and forth or front and back. We're not grabbing a tooth and yanking it, because if you do that, you're going to cause a lot of damage to the bone. So we do it nice and gentle, and we just coax the tooth out until it comes out completely. However, once in a while, when the tooth is in really bad shape or in bad condition or is badly decayed, what happens when we're taking out the tooth with our forceps, a root breaks off. And so what we'll use to get that out is a root tip pick. So a root tip pick, it's got a little bit of a point, helps you go down into the socket and get out that tip. Once we remove any broken tips that might have happened, we're going into the sulcus with our surgical curette. So it looks like a big spoon, and basically that's what it is. So it's just a big spoon for surgery, and what that does is going to get out any granulation tissue and maybe any leftover bone that could have been left in there, because we want to make sure you get out all of the bone fragments and any diseased tissue out of the sulcus. Once that's done, we're going to use a sterile water. All right, we do not use our air water syringe for this situation because we don't want to introduce any bacteria into the socket. So we use that along with a irrigating syringe. All right, so an irrigating syringe, these are disposable syringes that will be thrown out afterwards. Okay, there is no point at the end. It's just a plastic nozzle, it's very gentle, and that will just gently irrigate the socket. Make sure we get out any debris. And while we're doing that, of course, we're going to be using our suction. So you've got a disposable plastic surgical suction tip. You also have a version that is sterilizable. You normally have a little brush that goes inside of here and basically will clean out any blood or debris that gets in there. You got to make sure you clean these very, very well. I recommend using the disposable ones because it can be quite difficult to clean out a suction, and obviously nobody wants somebody else's blood in their mouth. Afterwards, of course, you'll be using sterile gauze. So normally we will be using sterile gauze when we're working with this situation, so we do not use our gauze that's on our counters normally. We use sterile gauze. To make sterile gauze, it's easy. You just take some 4x4 gauze and put it into, or 2x2 gauze, and put this into a sterilization pouch and sterilize it as usual on a wrap cycle, and you end up with sterile gauze. You don't have to buy anything fancy. You can make it yourself. And you want to make sure that you have some for the dentist, and of course another package for the patient, because you'll be giving the patient some 2x2 gauze to bring home so that they can keep pressure on the area and to prevent further bleeding. And that is your basic setup for an extraction.